Have you met your state representative? What issues concern you most in Texas? Healthcare, education, taxes, something else? Do you know what goes on in the Texas State Legislature? Does anyone? We are pleased that our conversation today on Access News is with State Representative from the 48th District, Donna Howard. You're watching Access News, hands on news. Donna, thank you for being here with us on Access News today. Thrilled to have you. You have a background in nursing, specifically critical care nursing. People of Texas, you've been serving the people of Texas in the legislature since 2006. How did you move from nursing into politics? What led you through those events?
Well, actually, it was kind of a journey, but basically, I grew up here in Austin. I went to the University of Texas in the 70s when there was a lot going on, so I've always been very involved in the political process, got involved with good government groups back then, and when I became a nurse, I was involved with my professional association and the legislative activities of that association. But really, what really changed things was when I had kids, and I got involved with the public schools, and eventually was elected to serve on the school board in Eanes. And from there, just continued to be a part of politics and eventually ran for the state legislature and won.
Were you always into politics then, or really you started when you had children?
Well, I was only into elected politics once I got involved with the public schools. But I've always been involved in the political process. When I was at the university, as a student, one of the organizations that started then is called Common Cause, and it's all about good government, people being involved in the process of government. So that's something that I've always been drawn to.
You say that when the children were born, you noticed issues in the public school. Was it any specific incident that really inspired you to go that direction?
Well, it's kind of interesting. I think this happens to a lot of people. It's very personal when it deals with your own children. And it was boundary changes. Children were going to have to be going to different schools after they had started going to schools that they really loved and I really loved. And that oftentimes is what gets parents more motivated, is they're looking at their own children and decisions that are made about the schools that will impact their kids. So I'm no different. That's what got me involved.
Right. So when you decided to go into politics, did you feel that you got a lot of encouragement from your family and friends?
I think basically, yes. You know, when I ran for the state legislature, my husband was very supportive. In fact, when I was first asked to consider running, I wasn't sure it was something I wanted to do. It seemed like I would have to know about a lot of things beyond education that I wasn't sure I was prepared to learn about. But my husband was the one that said, you know, this is something you can do, you should do, and I'm behind you, and I will help you. And so, yeah, my family's been extremely supportive.
I'm sure your family is very important to you. You mentioned campaigning. Can you tell me a little bit about the difference in campaigning and the actual work that's done in the legislature?
Well, campaigning, I think, actually, that's when people talk more in extreme language. There's more rhetoric that surrounds campaigns. When you actually get into policy making and legislation, I think there's really more of an opportunity there to find opportunities for common ground and shared values that you don't always see on the campaign trail. In fact, one of the things I was pleasantly surprised about when I got to the legislature is that the vast majority of the people there share the same values. We may have different ways we want to solve the problems that we face, the issues that we face, but by and large, we all care about our families and our communities and want to do what's right for Texas.
In this election year, obviously, this is a very big election year. We see a lot of news related to the war on women, specifically in Texas, the war on women's health services. Obviously, as a woman in Texas, and you have an extensive background with medical, what is it like being in the legislature and doing work related to women's health services?
This last session was extremely challenging in regard to women's health care. it seemed that it was a daily assault, quite frankly. We ended up, I would say the legislature, I was not supportive of this, I was opposed to it, but the legislature ended up cutting family planning by 2/3. And then after the session ended, we had the challenge of how we were going to support the Women's Health Program, which is a Medicaid program to help women get preventive health services and contraceptive care. So it's been continuing challenges that have eroded women's options, especially poor women, underserved women who do not have access to the kind of health care that they need. And we know, as a nurse, I can tell you that the Centers for Disease Control have said that family planning is one of the greatest health achievements of the past century. It has allowed us to see reduced infant and maternal mortality rates. So this is not just an ideological issue, as some seem to think it is. This is a real public health issue, and it saves the state millions of dollars if we can prevent unwanted pregnancies. Costs a lot less to do the prevention than it does to pay for births with our Medicaid dollars.
Speaking of unwanted pregnancies, Texas is one of the highest in the U.S. for unwanted pregnancies. Why do you think, what is the problem and what can we do about it?
There's a lot of reasons probably for it. You know, we've had a focus in our state on teaching only abstinence. And there's no one, I think, who would disagree with the fact that abstinence needs to be the primary thing that we focus on. But we've had several years go by where schools have thought that that was the only thing they could teach, even though that is not what the law says. Teaching students about what's available to them to allow them to be safe and protected is also important. And we know that when you have information that gives more of a comprehensive approach, that you actually see a reduction in the unplanned pregnancies. There's probably a lot other factors, so some cultural factors involved, but yes, Texas has a real challenge there.
Since we're talking about education, I know that you are on the Texas Committee for Higher Education. Mm-hmm. I read that the Texas Republican Party platform, they are opposed higher order thinking skills, or another word for that would be critical thinking skills. The reason why they don't want to undermine parents' authority or challenge any fixed beliefs of the students. What are your thoughts about public schools telling students how to think, or according to Republicans, teaching them how not to think?
Again, we're getting kind of into the political rhetoric here, and critical thinking skills has kind of been synonymous with different approaches to education that certain ideologues have been opposed to. I would imagine most of my Republican friends and colleagues want their students, their kids, to have critical thinking skills. The problem is when we get into political battles over how students should be taught and what they should or should not be taught. For instance, the State Board of Education and all their challenges with whether or not to teach evolution, whether or not creationism should be a part of a science curriculum. Those kinds of things have really been a disservice to 21st century education in our state, and it's very unfortunate that we've politicized education. You know, the simple fact is that we are not doing the kind of job we need to do to prepare all of our students for 21st century workforce. And that means that we've got to do
What should we be doing?
Well, we should be focused more on giving kids exactly what they need to be prepared for the STEM jobs, the STEM curriculum, the science, technology, engineering, and mathematics. We should be making sure that those kids who come from more disadvantaged backgrounds have what they need early on with early childhood education, so that when they come to the public schools, they're better prepared. Right now, when you have kids without resources coming to kindergarten, they are far behind their peers simply because they come from households that don't have books, that don't have the same language, and they come with a much lower vocabulary, which puts them at a disadvantage. We need to be getting away from some of the standardized tests that are so focused on the test that the teachers are having a hard time finding enough time within the day to actually focus on the kids and what they really need with the curriculum. There's a lot of things we need to be looking at here, but we're not doing what we need to do to make sure that all students have the quality public education, and then to help them have access to post-secondary education, which is really critical for today's jobs, since the vast majority of all new jobs require some form of post-secondary education.
Right. I know that teachers really face huge challenges trying to meet state standards, but at the same time, customize their teaching styles or ways they approach the students. I can imagine that's a very tough balance. I wonder, what do you think the legislature's attitude toward public teachers is?
Mixed. I think that we all recognize the value of teachers and know that one of the most critical factors is a quality teacher in every classroom. There are some, though, that have, I think, kind of eroded the public confidence in teacher by the constant criticisms that we have seen to teachers, and the high-stakes testing, which have implied that the teacher is essentially totally responsible for what happens here in the classroom. We know that there are a lot of factors involved. Parental involvement's a factor. Whether or not, as I said before, they have the resources at home. People say, let's not throw more money at education, but quite frankly, if you look at the high-performing schools in our more affluent areas, they may be getting basically the same amount per student statewide funding, but they also have the opportunities to get tutors for their kids, to take their kids on cultural excursions and trips, to send them to camps, to do all kinds of things that enrich and support the child's learning environment. So quite frankly, in my opinion, no, I don't want to throw more money after schools, but I want to make sure we invest an adequate amount so that all kids have the same kind of opportunity.
How will we know what is enough? How do you measure that?
And that's been one of our challenges. We've had some studies about what is adequacy, what is an adequate education. It's a very difficult thing, I think, to measure, but that's going to continue to be part of what we're going to be looking at with all the school finance lawsuits that are before us right now. When we come back to the next legislative session, there's going to be a lot of lawsuits going on that we're going to be paying attention to that have to do with funding. And one of the issues of funding is funding an adequate education, and what does adequate mean?
Right. It's a very good question, I suppose. While we're on the topic of finance, I want to ask you about the Texas budget. I know we are a huge shortfall, multi-billion-dollar deficit. How did this happen, and what can we do about it?
There's a lot of reasons we came up with a shortfall. Part of it is because we've been neglecting to address certain budget problems for years and years and just kind of hiding some of these issues. So for instance,
like what?
Well, this last budget that we had, we're constitutionally required to balance our budget, and we did balance it on paper. But what we actually did is we did not fund Medicaid totally, so we knew we were going to provide the service, but we underfunded by about $5 billion. The comptroller has said that we have diverted $5 billion from its intended purpose and just kept it in general revenue to help balance the budget. So in other words, we're taxing you something or assessing a fee on you to pay for a certain program, but we're not paying for that program. We're keeping that money back to balance the budget. And then finally, we deferred over $2 billion of our public school payment that we owe and pushed it into the next budget. It's owed in this budget, but we'll pay it in the next budget. So if you add all that up, there's about a $12 billion hole right off the bat in our so-called balanced budget. And those are the kind of maneuverings we do. And we haven't raised the motor fuels tax since 1991, and that's what helps pay for our roads and our transportation infrastructure. But we, for the first time ever, have appropriated more funding for debt service than we did for actual paying for roads and highways. We just have lots of problems with figuring out how do we really want to get the revenue we need to provide the government services that most people believe we should be providing.
Talking about appropriating money for health care, how surprised do you think Perry was when the Supreme Court decided to uphold the Affordable Care Act, the Obamacare?
I don't know how surprised he was, but I'm sure he was disappointed in that. I have a hard time figuring out how ultimately he or anybody else of his mind would decide that we can forego the billions of dollars that we'd be getting from the federal government to help pay here in Texas, where we have the highest uninsured rate in the nation, to help pay for health care for our citizens. And the fact is, those are federal dollars that our taxpayers have paid to Washington in their federal income taxes that should be coming back to Texas to pay for Texans' health care, not going to other states.
Is there any other area that you see where we could make cuts to balance the budget?
Well, we were talking about accountability of schools a while ago. I personally think that we could alter how we do our statewide accountability system that could save us some money. I don't think that the state needs to be in the business of testing every single child every single year to determine how the state is doing. I think that kind of testing is diagnostic and should be in the classroom with the teacher, so that the teacher can help the student, close the gaps they have in their learning needs. What the state needs, I think, is more of a scientific sampling, kind of like what we do at the national level, and that most people accept with SAT scores, ACT scores, the National Assessment of Educational Progress. A scientific sampling that tells us basically how are our students across the state doing, to give us a general idea of how effective we're being. I don't think we need to have the kind of expense that we have placed in this kind of high stakes testing that I don't think is giving us the answers that we really need.
Do we really need to look for additional revenue?
Well, let me put it this way. The state of Texas ranks at the bottom in expenditures per capita, and we have for a long time. From 47th to 50th, whatever, we're at the bottom. Which means that even though Texas is around, I think probably around 23rd now, somewhere in the 20s, in terms of its wealth per capita, we are a fairly wealthy state. We still spend the least on our citizens of any other state. So do we need...
And when you say when we're spending money per citizen, what do you mean?
So if you add up all the dollars that state government spends on our citizens and divide that number by our population, the number you get per citizen in our state is at the bottom compared to other states if you look at how much they're spending on their citizens. So we are very lean already. There is no fluff in our budget. And I think we need to have an honest discussion with people about what do you want government to provide and how much should it cost and how do you want to pay for it. Right now, we don't seem to be willing to have those discussions. We can't talk about taxes. Politicians don't want to talk about taxes. But at the same time, you have to pay for these things somehow. And as I said earlier, we're not paying for what we're providing right now. We're using accounting gimmicks and tricks to do it. We're not being honest with taxpayers about where some of their dollars are going. We don't have the money for our roads and infrastructure. Water is a huge issue, and we passed a water plan in 2007 that we haven't paid for. It would cost about $53 billion to pay for that water plan. And all we've appropriated at this point is $100,000 to allow for some bonds to be issued in local communities. We are not having these discussions with citizens so that we can be honest about what it is we want government to do, and let's talk about what revenue do we need and how do we want to get it.
Obviously for me as a taxpayer to hear that, I feel a little angry about the money that I'm paying isn't coming back to me and my family. So what can a taxpayer like myself do about the situation?
This is the hard thing, I think, because there's so much to have to learn about. And, I think citizens need to be more apprised of what's going on. Part of it, though, is politicians aren't always so good about explaining things and talking honestly about what's going on. So it's really, we both, I think, have to do a better job about being willing to get the information, and politicians and elected officials being willing to share the information. But I also think you have to have some confidence in your elected officials. We're supposed to be representing you. And so we need to make sure we know who we're electing and that they know what the issues are and that they share our values and that we can count on them to do what's right for us since we're electing them to do that.
I also hope that during the show, this Access News, that the citizens get a little bit better information on some of these topics so that they can choose the right candidate for their district
Exactly,
representative.
and that's the value of a program like this.
I also want to talk a little bit about your experience in the state legislature.
Mm-hmm.
You are Democrat, but the legislature is Republican. What are the difficulties that you face when you're trying to get a bill passed in the legislature?
It's very challenging right now when you have the kind of breakdown that we have where you don't even need a Democrat to show up for a quorum, when you don't need to have a Democrat show up to have a supermajority vote. Clearly, the Democratic Party was irrelevant if you look at the numbers in this last legislative session. It doesn't mean we can't do things. And it's all about relationships, it's all about credibility, it's all about trying to find common ground and common values. And in fact,
do you see that
yes,
in the
I
legislature?
do.
Or is there a willingness to compromise? Or
I don't know
really
about that.
Is there a divide, just like at the
I don't know
at the
about
federal
the
level?
willingness to compromise right now because they don't have to. But at the same time, in this last session, during the special session, I had the opportunity to propose an amendment that I think was providing common ground. I said to my colleagues, you have pledged not to touch the rainy day fund, but we know the economy's doing better. Any money that comes in above that you haven't pledged not to touch, let's let that go to our schools to help cover enrollment growth. And I had support, it passed. But after it passed, my colleagues started getting calls from ultra-conservative groups who did not think that they should ever find any new revenue, and they started backing off of the vote, and eventually it was stripped from the budget. But the fact is, I think it's a good example of if you do try to find something meaningful, common ground, common sense, practical, that helps all Texans, that regardless of the R or the D behind your name, you oftentimes will come together around that. But again, the powers that be intervened and it didn't come to pass.
Have you ever experienced a bill that you really, really wanted to pass and it just didn't happen?
Yes.
Are there a few other examples that you can give, something that you really felt strongly about?
Well, I have followed the State Board of Education for years, and I had a bill that would take the management of the multi-billion-dollar permanent school fund out from under the partisan elected State Board of Education and put it under the Comptroller's office with folks whose only job is to manage funds. That's their expertise, rather than State Board of Education members who are not required to have any expertise. And it passed in the House, and it had to pass a threshold of over 100 members, and I got 104. It was very challenging, but I got it through. Unfortunately, it never got brought up in the Senate, so it didn't happen. But I mean, that actually did get through the House. It wasn't this legislative session, it was before we got quite so skewed in our representation. And there are other examples I could think of like that where, but even in the House, where I have proposed things specifically about education, that I was very disappointed that the rhetoric knocked things down before we had a chance to really talk about how is this really going to improve the lives of Texans.
Do you have any bills that you are just so pleased that you saw get passed?
Well, as a nurse, one of the things that I'm very happy about is some of the work we've done with nursing workforce issues and the ability to get more money invested in the nursing shortage. That was cut some this last session with all the cuts that we had, but I feel really good about that and about some legislation I had to add issues in the workplace where nurses could report unsafe patient conditions and not be retaliated against.
This is an election year, and I'm sure you've met many undecided voters.
Mm-hmm.
When you meet them, what do you tell them?
Very good question. You know, I like to talk about the fact that I do have a lot of experience in this community, that I care about this community, that my background in nursing and being on a school board addresses a lot of the major issues that people have concerns about, education and healthcare. In fact, that probably comprises 80 to 90% of the state budget, education and health and human services. So I like to talk about the fact that I have that background. I also think it's important for people to know that I do my homework and that I work well with others and that I try to make sure that all stakeholders are involved and that when I make decisions, and I take that very seriously when I punch that button and vote, that I'm thinking about what's best for my entire constituency and the state of Texas at the same time. The fact is that I don't vote along party lines. I vote for what's best for my district.
Thank you, really. It's been a pleasure chatting with you today on Access News, and we appreciate you being here.
Thank you.
You can learn more about the work of Donna Howard at her website and at our website, accessnews.us, where you can ask questions, share your comments and opinions. Like us on Facebook, follow us on Twitter. One beautiful thing about America is that we, the people, have power. The more we know, the better decisions we make. For Access News, I'm Tamara, and that's Austin.
That was great. Thank you.
Great conversation.
Created, written, and executive produced by Devorah Benn-Moshe and Ken Hurley. Hosted by Tamara Suiter-Ocuto. Interpreter for Tamara Suiter-Ocuto, Jennifer Stoker. Special thanks to Texas School for the Deaf. Funding provided by the John S. and James L. Knight Foundation. Supported by Austin Community Foundation. Production by Austin Community College. Civication Incorporated, www.civication.org.